So it's the next question of one of our rapid bombs. Again, this is an undercover peek as to what our Rapid Bombs podcast looks like. These are questions we've literally gotten from that podcast that we have. Again, almost 400 episodes there. A 4-year-old child presents to the emergency department with fever, irritability, and widespread skin erythema, followed by the formation of fluid-filled blisters that rupture easily. The diagnosis of staphylococcal scalding skin syndrome is made. Which of the following treatment options is not appropriate for this patient? It's the dreaded not. Is it A, aggressive IV fluid resuscitation, B, intravenous dicloxacillin, C, topical wound care similar to thermal burns, or D, IV corticosteroids? Briggs, what's the correct answer here?
Correct answer is going to be choice D, IV corticosteroids. So again, we're talking about staphylococcal scalded skin syndrome. We've had a couple episodes on these. In this condition here, it's a severe skin infection. It's caused by, wow, I wonder what, Staphylococcus aureus, which releases toxins that cause the skin to blister and peel. Now, what we've talked about previously is that this happens almost exclusively in kids.
Right.
I'm sure there's cases in adults. Doesn't really matter though. It's almost always going to be in kids. And on the test, for your knowledge, it's 100% in kids on the boards.
And for kids, we're talking about less than 6. Briggs,
absolutely.
Right. We're not talking about, they're not going to present a 10-year-old. It's going to be less than 6.
No, going to be less than 6. And the big deal here is you want to start treating with antibiotics early. So going into these answer choices here, everything sounded really good up until choice D, which was IV corticosteroids. So you're going to give IV fluids. That's great. These kids often have severe dehydration due to that desquamating skin loss from their rash. You're going to give IV antibiotics. Dicloxacillin is suitable. It's penicillinase resistant, anti-staphylococcal. Now, other choices, of course, that are suitable that, a lot of people don't give dicloxacillin really anymore. I feel like, ceftazoline will be okay in some cases, nafcillin. And if you're concerned for MRSA, let's say they've had this before, or there's a MRSA exposure, Bactrim or vancomycin is a reasonable choice, or honestly, doxycycline too in some kids.
And on the test, Briggs, they're not going to give you different antibiotic choices for this one. It's mainly going to be recognizing antibiotics need to be given.
Right. Absolutely. Yeah. So Bactrim and vancomycin will be the big things here. Now, topical wound care, straightforward stuff here. You're going to treat these like thermal burns. Similar management, preventing infection, promoting healing. Lotions are important here, Bacitracin and that sort of thing. That's going to be the same exact management as we do for a lot of our burn patients. Now, the reason steroids are wrong here is because...
Wait, so steroids are not indicated in every skin condition? Hold on.
Exactly. IM steroid injections...
I should pull like a lever here. Put on the brakes.
Pull the brakes. Get like a cartoon animation for our brake stopping.
Skin condition presenting...
Looney Tunes thing. The reason steroids aren't helpful here is because it doesn't make any sense. You're treating an infection in this case for the skin. Steroids really have absolutely no evidence supporting the use in this condition. They can actually worsen the systemic infection. So think twice before doing this.
Do it.
I would never think about doing steroids before or after this question. So anyway, steroids can suppress the immune system. They worsen the underlying staph infection. In general, if you have a skin infection, don't give steroids.
Hey, I'm going to make another short here for our YouTube channel. All right. So
let's be really short. Don't give steroids.
This is going to be super short, right? So the appropriate management for staphylococcal scalding skin syndrome in children, again, almost always exclusively presenting below age 6, is aggressive IV fluid resuscitation. Remember, there's going to be significant, fluid loss. It's going to be IV antibiotics that are anti-staphylococcal, obviously, and then topical wound care that's similar to thermal burn management. That's the last little thing here that we want to say. Systemic corticosteroids are not recommended for treating this condition, as there's no evidence they work, and they could lead to worse outcomes. Done. Now you know how to treat SSSS.
You got all of them.
I got all of them. Next question. SSS. I don't want to add the other one on, Briggs.